when should someone use a rapid antigen test?
So this is the question that comes up quite a bit. To answer that, I would like to explain the difference between a rapid antigen test and a classic gold standard PCR-based test. So both of these tests require a swab, but the PCR test is using a lab. It uses very complicated machinery that does this chain reaction, and that's what the PCR stands for, polymerase chain reaction, and it amplifies a piece of the genetic material in the virus, which we call RNA, and amplifies a piece of that genetic material that's found on the swab to then produce a result. And that result can be positive, can be negative, and it's really very accurate test that we use to diagnose someone with symptoms. It's considered to be a gold standard in testing. And we also have the rapid antigen test. Their main benefit is that they're rapid, so you get the answer within a few minutes. And after you collect the sample with the swab, you mix it with a little bit of reagent, and you put it on this little small strip that you wait 15 minutes or so, and then you start seeing two lines. One line means negative, two lines means positive. So this is very similar in concept to what we might know and remember from, let's say, pregnancy tests. And this test is not checking the RNA, this part. It's not checking this part of the virus as the PCR test. This is just checking whether there is protein, any of the viral proteins in that sample. So by nature of this is a far less sensitive test compared to the RNA test. It's used for screening. It's used to enhance screening. So if someone is already undergoing screening for symptoms, if they're negative, the additional level of protection can be achieved by also adding that a rapid antigen test. And if that test is negative, then the person is okay to go in. And we've seen that in workplaces, we've seen that in other settings as part of the very comprehensive, thorough screening process. But that test is not appropriate or not recommended by both World Health Organizations as well as our own Ontario Ministry of Health in diagnosing people who are symptomatic or testing those who are high-risk contacts of COVID-19.